Thanks for joining us today for BRMC's Healthy Connections. Our guest, Tammy Mitchell, with the Baxter Regional Wound Healing Center. Tammy, what's going on over there at the Wound Healing Center this year? We've got a brand new year started. 2012 is here, and we let everyone know back in 2011 that you've now got 3 hyperbaric chambers over there.
Right.
And so what's happening at the Wound Healing Center?
Well, actually, we just kind of reflected back, and we have now been in our new building for 2 years.
Which doesn't seem possible.
It doesn't, and it has just been such a wonderful time, and it's such a good place for our patients to be. And then we added the 3rd chamber last year about this time. So now we've kind of come full circle with that, and we are welcoming new patients every day. Patients call on their own many times.
So
they hear about us.
They don't always need a physician referral then to come and see you.
No, they absolutely do not.
Okay.
We welcome physician referrals, any kind of provider referral, and patients hear about us like on this show, and they hear about us on the radio, and they hear about us through the mail and in newspapers. And sometimes patients live with wounds for years, and they really don't know they have options. And so patients can call and make their own appointments. If they have a private insurance that requires a referral from their primary care, we will assist them in getting that, make the phone calls, make sure that everything is like it's supposed to be before we get started.
Yeah. Now, what kind of wounds do you typically see at the Wound Healing Center?
Well, typically we see wounds on lower extremities, on the legs.
Diabetes related?
Diabetes is a huge perpetrator for those kinds of wounds, and I would say 20% of our wounds are diabetic wounds. However, other wounds on the lower extremities can be from poor circulation, either arterial or venous, and so that is what we see a ton of. We see other things as well, maybe surgical wounds that haven't healed over a regular course of time, traumatic wounds, sometimes pressure ulcers that have formed over periods of time. But the wounds that I'd like to really think about and encourage our viewing audience to think about are maybe wounds that you don't see, wounds that are not on the skin, that can be seen visibly. Those wounds can form over time after perhaps a series of radiation therapy. And it's just one of the things that can occur from radiation therapy. And an example of that might be a patient who has had radiation to their pelvis, either for prostate cancer, bladder cancer, some type of colon cancer. And over a period of time, because all the tissue has been radiated, not just the malignancy, and thank God that has saved their lives. But sometimes patients develop chronic pain or chronic diarrhea or frequency with urination, pain with urination, maybe some bleeding with urination. And I think that I want to encourage them to speak to their doctors about that. I think patients are very thankful just to have their life back.
You bet.
Yes.
You bet.
Yes. And so they think that maybe they should just live with these things, or maybe it doesn't even click that could be a side effect. Not all patients that have radiation experience that side effect, but certainly there are some. By saying that, those injuries can be treated in the hyperbaric oxygen chamber. And insurance pays for that, Medicare pays for that, but beyond the pain for that, it totally reverses the effect of that.
Can you, being a nurse and knowing the clinical side of this, I'm always fascinated whenever you come on the show and tell us about how the hyperbaric chambers work. For some reason, I went through the misconception for many years, and really know that you are the one that can straighten our folks out so that they understand. I was under the impression that hyperbaric chambers were filled with oxygen and it worked from the outside in. And when you've been on the show before, you've stated, oh no, Donna, it works from the inside out.
Yeah.
So it's actually, so tell us how it works.
You know, that's kind of a common misconception because before I was in wound care, I thought the exact same thing.
Yeah.
And I think we've all seen pictures of those chambers that fit over a leg.
Right.
And that was topical oxygen therapy. But with the chamber itself, it is systemic. The patient breathes the oxygen, and it's 100% oxygen, and it's compressed to a level equivalent of atmospheric levels below sea level.
Okay.
ATAs, that's called.
Okay.
And by breathing the compressed oxygen, the first and easy quick explanation is that it superoxygenates our blood cells, which then are delivered to the areas of our body that require healing, and that stimulates regrowth of tissue. Now that's the simple, that's one of the simple explanations.
The oxygen knows where to go?
The oxygen knows where to go. The blood knows where to go. Your body's cells, the white cells, the T cells, and I'm going to speak about stem cells because lots of talk in the news media around stem cell research. Well, our own bodies make stem cells.
Right.
And it's very huge. This is a very huge thing, but the hyperbaric oxygen stimulates our own bone marrow to create cells that are not, they're stem cells, and they're not dedicated to any body type until the body knows where they need to go, and then those stem cells then adjust themselves to where they need to be. For instance,
that's amazing.
I know.
We were talking about earlier, just before we came on the air, about we were teasing Gil, who runs XL7, does this wonderful show for us, about the float pool. Now, when you're in healthcare, you know what a float pool is, and he was calling it something else, and we were saying, no, it's a float pool. It's a pool of nurses that when there's an area, a nurse calls off sick, or there's a lot of surgery going on, so they know they're going to need nurses more over in this area for that particular day. So they float. They have excellent qualified nurses that can plug themselves into a unit or any area that they're needed. So sounds like this is what's going on with the stem cells. Okay, guys, where do you want us?
Right.
Okay,
right.
And they head in that direction.
And they head
where
in that
do you
direction.
need us?
And they identify themselves with that and become that kind of tissue.
That's amazing.
I know, it is
That's
amazing.
amazing.
It's very very scientific,
yeah.
And there's a lot of scientific ways to explain it. Some way over my head. I've been recently to a symposium back in November, and we heard a lot of speakers that talked about the science of hyperbaric oxygen, how it works, why it works. And so the research is always ongoing, always.
Right, and it just keeps getting better and better and better.
It does. And the United Hyperbaric Medical Society is always looking to expand the uses for hyperbaric oxygen. So Baxter Wound Center is extremely fortunate in that we are plugged into some of those research facilities.
Yep. Yeah, we are. We are, absolutely.
Yeah.
Now, you talked also about old wounds. Talk to us about some of the cases that you've seen that have come through. I mean, did we not talk about one time a gentleman that actually was from World War II?
Yes.
That
sustained an injury and had dealt with that for 40 years.
Yeah.
Right.
Yeah. And got into the hyperbaric chamber?
He did not get into hyperbarics.
Oh, okay. Okay.
He did not require hyperbarics, but he came to the wound center and his wound was excised. It was biopsied.
Okay.
The malignancy was removed and he was healed within 2 weeks after 40 years.
After 40 years.
Yeah.
Those are great results.
I know.
Absolutely. Wonderful results.
You know, the other great result is that we are able to look at our healing rates and compare those to other hospitals across the United States. Yeah. And the standard for healing, the achievable standard, is to heal wounds 80% of the time within 16 weeks.
Before you give us your results,
okay,
we need to take a break. So that'll get you to come back and join us. We want to find out where we stand nationwide. We'll be right back.